I was born in 1943, so my whole childhood we had a health service. And now I have to say that people who wanted to subscribe to private medicine and to take out insurance and go to private doctors and things, they were welcome to continue to do that, and they did. And there was a big economy, nothing like the size of the National Health Service, but a big economy in private medicine that went on parallel to the National Health Service without anybody being screwed rotten. It worked. It worked. The two things can work together. So that stuff about giving up private insurance is bullshit. But what's happened in England is that what's happened to the National Health Service in England is the propaganda war against it has been so intense after Thatcher and Reagan, who are the great devils of the neoliberal economic revolution, which has destroyed most of the Western world. So after it, they decided, hey, we should start selling bits of this off. Anything public, let's sell it off. Let's sell the railways to Richard Branson. Let's do this. Oh, let's sell these hospitals to these American pharmaceutical companies. You should watch, and maybe you've watched it. I know you've made your own documentaries about medicine, and they're very good too. I've watched them. But John Pilger has made a documentary about, it's called The Dirty War on the NHS. And it is heartbreaking. You know what's heartbreaking? I'm almost in tears speaking about watching one particular nurse who had worked in a hospital somewhere in the mid-counties in England, in the middle of England, and she'd worked there for 25 years, and it was bought up by an American corporation, and everything started to change. And after a bit, she realized that you got merits as a working member of the staff, not for looking after people, not for caring for the patients, but for getting them out so that you could sell the bed to a new patient. And you were graded on that. And if you didn't get rid of them as fast as possible, because they make the most money in the first 8 days that they're in there or something like that, you start to get a ticking off from the people that are above you in the hierarchy in the hospital. This woman is in tears. She had spent her entire career as a carer, somebody who loves her fellow human beings and who had worked as a nurse, and she loved her job, and she's had to leave because it's nothing to do with caring for patients. It's to do with making money. And of course, the arsehole who owned the company and who sold the idea to the local health authority, who sold the hospital to them, sold them this huge spiel about efficiency and how it would be much better if it was privately run, and how wasteful the administration was under the NHS. And it was all complete bollocks. It was an absolutely filthy lie, and they stayed there for 2.5. This is all in John Pilger's documentary. He says it more eloquently than I could. They stayed for like 2.5 years and then got out, taking a huge dollop of cream off the top, and left everybody in the shit. Gone. All the investment removed. Boom. Oops,
and these were American investors in American company.
Yeah, it's an American investment company.
What has happened in the UK that would even allow a hospital to be owned by a foreign private investment company?
Well, yeah.
I will put the link to John Pilger's documentary on my podcast site. So anybody listening to this afterwards,
along with you, John is one of my big heroes. I've known him for 40 years, and he's spent his entire life, like you, trying to tell us the truth about some of these things that make life unbearable, not for me, but for many, many, many people. They make life unbearable. And what makes life unbearable is profit. People wanting to take more out of something than they put into it. And that being considered absolutely the best thing that anybody could do in the world. So we pay people who shuffle paper money about more than we pay doctors or nurses or teachers or university professors or rock stars, or poets, or musicians, or anybody. In fact, the creative people in society, but they say, what are you talking about? Well, junk bonds are creative. You can make money from nothing. You can make yourself very, very rich. Yeah, but you make other people very, very poor. Oh, that's the whole point. That's what it's for.
Hmm.
Well, that's it. And that is what it's for. Yeah, it's just
Don't you
weird.
think that as long as we have this system that's based on profit and growth and greed, that all these societal issues and ills that we have are not going to get corrected, whether it's the healthcare system, whether it's climate change, all these things that unless you go at the core, right at the heart of the evil, we're just going to spin our wheels for
Do
so
you know
long.
the real core of the evil is that they in this, which is probably the PR industry, have persuaded almost everybody that you see on the street or anywhere in this great country, and it is a great country, that anything that has this word, the S word attached to it, is death. It's the plague. And the word is socialism. Socialism.
No, don't say it. Don't say it on my podcast, please.
Well, exactly. Socialism is great. What it means is looking after the citizens, having a safety net, having a health service, having pensions, being able to retire when you're 65 and enjoy gardening, not having to live in a effing tent or the boot of your car, right, even though you might be doing two jobs and so might your wife and your kids, because they only get paid $15 an hour and nobody can survive on it. And they think it's all right. Jeff Bezos thinks it's fine. So does the Walmart guy. They all do. They think, why are they complaining? Well,
right. And it's always amazing to me how the profiteers will always find a way to make a buck, even in the things that they disagree with.
Socialism.